Hello everyone. My name is Catherine Davidson and I head up the Life Science Sector team at MIDAS, which is Greater Manchester's inward investment agency. And our role is to support companies to set up and grow in the region. Today, I'm going to give you a short summary outlining Greater Manchester's life science ecosystem and the local expertise in the use of data and AI to support new healthcare innovations. So just a quick reminder to double-click on the box to see the slide deck, and if you have any questions, you can post them in the chat at any time. So I'm going to start off with an overview of Greater Manchester and what makes the region such a beacon for development of digital and data-driven healthcare solutions. So Greater Manchester is a region that has a population of 2.8 million people. It's a very diverse population and also has a high incidence of chronic disease. And Greater Manchester is a devolved region and unique in that it is the only area in England to have control of its £6 billion health and social care budget, with the aim to improve the health of its population by putting patients at the heart of healthcare delivery. So throughout the region, there's a greater willingness to collaborate and embrace new technologies, ultimately giving patients greater access to new diagnostics, new therapies and clinical trials. And this has contributed to Greater Manchester's global reputation as a testbed for new diagnostic and analytical technologies. And healthcare innovation is a key part of Manchester's local industrial strategy, aimed at gaining an additional 5 years healthy independent life for its population. So we're specifically prioritising digital and tech-enabled solutions to support this. And these ambitions are facilitated by Health Innovation Manchester, which is the region's academic and health science network, bringing together industry, Greater Manchester's academic and research expertise with its health and care organisations to address the local healthcare challenges. And I'll talk more about how they do this later. So to understand Greater Manchester's strengths as a digital health location, you need to have an appreciation of the region's wider digital infrastructure, capabilities and priorities for the use of digital technologies and population data. So as a leading digital location, Manchester has piloted a number of programmes that work to increase access to and sharing of data to improve healthcare, or to improve public services, of which healthcare is one. And the progress being made is creating a conducive environment to understand population-level behaviour and support real-world evidence-based healthcare technologies and services. So the Connected Health Cities programme, information and technology to improve health and social care services for patients across the north of England. And Greater Manchester's involvement on this centred around improving diagnosis and treatment of stroke by analysing data from various primary, secondary and tertiary care to understand the patient journey and identify gaps and suggest improvements. At a more specific level, this utilised AI and machine learning to develop an app which enables delivery of a customised care bundle for stroke patients, and since implementation, this is saving approximately 2 patients per month. So Manchester was also chosen as the Smart City Internet of Things demonstrator, leveraging the wider digital infrastructure in the region to create an open platform connecting independent data networks. And again, this was a specific project aimed at mild to moderate COPD patients, looking at the use of Internet of Things to monitor medication compliance and physical activity through the use of smart inhalers and in-home sensors to build a picture of patient behaviour, with AI being employed to develop and deploy patient-specific coaching for better self-care. The region is also home to the first fully digital NHS trust in England, Salford Royal Foundation Trust. This has been spearheading the use of digital technologies, and they're collaborating with industry to develop a platform from which they can analyse data to manage resources more effectively for better healthcare delivery. So Jim Ritchie from Salford Royal will talk more about this in his presentation, so I don't want to steal his thunder. And traditionally, there's been a reluctance from healthcare organisations to share patient information, but these programmes have demonstrated the value of real-world data, allowing Greater Manchester's health and social care system to assess the potential for more efficient pathways and mechanisms of care delivery. And COVID has only acted to amplify this, expediting the region's ambitions to enable exchange of information across the various different healthcare settings, to the extent that Greater Manchester now has a fully integrated care record for all of its 2.8 million population, with plans to make this data accessible to industry to support health and social care innovation development. So Greater Manchester has a long-standing reputation as a centre of excellence in diagnostics, and its position at the heart of the North West Life Science Cluster, which is the largest medtech cluster in the UK, is built not only on the clinical and academic expertise in chronic disease conditions that are prevalent in the region, but also the local capabilities in bioinformatics, data analytics, and AI and machine learning. An independent research by Data Cities firmly places Greater Manchester as the UK's leading tech centre outside of London for expertise and capabilities in areas such as medtech, cyber, user experience, AI, and Internet of Things. And the combination of critical knowledge coupled with Manchester's collaborative and highly integrated life science ecosystem supports the diagnostic and digital health companies that are looking to develop and introduce new solutions. And this is where we're seeing the use of AI and machine learning coming to the fore in the life science sector in Greater Manchester. So we've got the predictive modelling work at the Alan Turing Institute to guide preventative healthcare programmes for those at high risk of developing disease or of deteriorating health. And Greater Manchester, as a genomic stronghold, there's organisations such as the Stoller Centre, with its focus on biomarker discovery, development and validation, that is using AI approaches to reduce R&D risk and help bring products to market more quickly. And it's this unique environment that saw QIAGEN not only establish the Genomic Centre of Excellence in Manchester, but also their formation of APIS Assay Technologies, which is their joint venture with Manchester Foundation Trust, to identify novel biomarkers for prediction, prevention, and diagnosis of disease using AI-enabled data mining. We've also got the multidisciplinary approach of organisations like the Institute for Data Science and Artificial Intelligence, the Centre for Imaging Science, and the Healthy Research Centre, all of which contribute to Greater Manchester's digital profile and support development of clinical decision support tools to aid diagnosis and guide treatment, and also diagnostic imaging analysis for early detection of disease. We've also, coming soon, is the new Christabel Pankhurst Institute for Health Technology. And the aim of this institute is to bring together the local strengths in digital health and advanced materials, so things like biosensor development, biocompatible materials, to develop and validate new tech-enabled healthcare products and accelerate their adoption through the innovation pathway. And this collaborative and integrated environment in Manchester has led to many new solutions being developed, commercialised, evaluated and introduced across the region's health and social care organisations. So central to this is Health Innovation Manchester, and they have been given a mandate by the region's health and social care organisations to actively identify and drive the introduction of new tech and data-driven solutions into routine use. And Health Innovation Manchester managed innovation pipeline by facilitating collaboration with healthcare and academia, and they're the leading partner in many of the incubator and accelerator programs and initiatives that we have running in Greater Manchester. And they work with companies to help develop their technologies, to help generate clinical evidence, and help support business case development to ensure that any new solutions that are developed are both relevant and viable to address the unmet needs of the local health and social care system. And they not only work with SMEs, they're also working with large global market leaders, adding value to existing products by digitising and exploiting data. And with many new solutions being widely adopted, not only across Greater Manchester, but disseminated out across the wider UK. And I just want to give you some examples of this. So they've worked with Medtronic on the Smart Hearts project. So this was taking data from implantable devices such as cardiac pacemakers and defibrillators, which transmit the data to the cloud. And they worked with Medtronic to co-develop an algorithm that has allowed for early detection of deterioration of heart failure based on real-time data flows before physical symptoms manifest. And this has led to a new model to treat heart failure at home reducing hospital admissions and improving patient outcomes. And they're expanding this project further with data being used to run machine learning algorithms to improve prediction of deterioration. And diabetes is another major problem in Greater Manchester, and another company that they've worked with is Gendius to help develop their app based on the use of artificial intelligence to calculate an individual's risk of developing complications from their diabetes based on the clinical history and implement self-management. Healthy aging space is a key focus area for Greater Manchester and also offers significant commercial opportunities for companies with technologies that can address key areas such as social isolation, mental health, and remote monitoring for early detection of age-related conditions such as frailty and dementia. And just to give you some examples of companies that are coming through the pipeline or have bid through the pipeline. So Safe Steps is an SME that's developed a digital falls risk assessment tool, which is being used to identify vulnerable care home residents and support them with a new care plan. And this has been successfully adopted by 2 Greater Manchester local authorities in health and social care. And this came through the Digital Health Accelerator programme. This company has also pivoted the technology to act as a COVID tracker to rapidly identify and manage patients with suspected infections or residents with suspected infections. And Health Innovation Manchester are working with them to develop a business case to roll this out across Greater Manchester. Another such organisation is House, who've developed a smart home monitoring system designed for older people. And again, this uses AI and machine learning to recognise an individual's daily routine and sends notification to our care team when changes in behaviour are detected. And this company is also working with EDF Energy to install this technology into age-friendly homes. And again, this is also another technology that has been pivoted for COVID-related management. And as part of the Healthy Ageing Grand Challenge Trailblazer programme, Greater Manchester is also establishing a pilot marketplace to develop and validate similar age-related innovations, which will then provide direct access into the local health and social care system across Greater Manchester. And just want to finish off now by giving you a bit of an overview of the services offered by MIDAS to support businesses interested in locating and expanding in Greater Manchester. So all of our services are free of charge, and MIDAS acts as a facilitator to businesses, providing a single point of contact to simplify and streamline the process in terms of sourcing property locations, connecting to the wider life science ecosystem, and supporting businesses for a period of at least 1 year and beyond to settle and grow in the region. So that's pretty much an overview of Greater Manchester's expertise. I think we've got a few minutes to take some questions, if there's any questions that have been posed in the meantime. One thing I've been asked is just to give some more specific details on the programmes for digital health companies in the region. So one such programme that we've talked about there is the Digital Health Accelerator. And this is a cyclical event that's run by Health Innovation Manchester. And it helps to provide engagement with clinicians and healthcare experts. As part of the programme, Health Innovation Manchester and local experts work with the company to refine the products to meet the NHS needs. It gives companies a better understanding of the local healthcare system and provides opportunities for businesses to showcase their innovations in local health facilities. So another aspect is also encouraging them and giving them greater market access and navigation. So hopefully that should give you enough of an overview. As I said, if anybody's any questions or want to explore this further, my contact details are on the chat there. But I'd just like to take this opportunity to thank you all for attending and be happy to continue this conversation offline. Thank you very much.